Happy Wednesday. This is Dr. Katie Toe, and welcome to Digital Smile Design with Injectable Composite. First of all, I would like to thank GC America Inc. for supporting dental education. And of course, a lot of you would be like, who's Katie Toe? So I want to a little bit introductions about who I am and how do I use digital smile design and injectable composite in my practice and make it a blue oceans and create a really unique, profitable niche for my practice and for myself. This is my husband, Dr. Barwin. We met in dental school, graduated 2010. Then he went on to complete his ortho residency. And we got married in Chicago. And I moved back to Houston, his hometown, and bought a prosthodontic practice in Katy. So Dr. Katie from Katy, Texas. So you probably hear that. It's very fun coincidence, but I love it now. And about a couple of years in after I purchased my practice, I met Dr. Christian Coachman, founder of Digital Smile Design. And it really changed emotional dentistry in my career and how I talk to patients, how we design the case, ideal design every single case, and present to the patient in an emotional dentistry way, and patients say yes. And one patient say yes, we got to know how to complete the case. And not every cases will be complete in porcelain. And I realized that there's a great opportunity when I met Dr. Terry. Dr. Douglas Terry, love his book and his passion. And I love the book Restoring with Flowable. Amazing photography in the book and so much knowledge. Met him, learned more about flowable composite, jumped right in, and I saw a perfect marriage between digital smile design and flowable injectable technique. And of course, my patients, the one that benefit the most from it. So I went on to complete my digital smile master and then also become a certified DSD clinic, which is the first in Katy. And it's a huge honor, especially now, everything that we do, every single case, we are going through digital smile design to give the patient the ideal and the best treatment. This is my first case with digital smile design and also using injectable flowable composite. So you can see that it's life-changing. And the patients didn't even know this was possible until we show him what possible. And now he said, I want it. Well, he was fine with the picture on the left for 55 years. And when you show them what possible, now they like, I want it now, right? And so the marriage between digital smile design and the injectable composite really brings so much possibility to your practice. And of course, we're going to talk about how profitable that is. This is actually my very first flowable injectable case. And you can tell the patient this is a same day picture. The patient have the same makeup, same shirt, and she looked like a teenager on the left and with 4 injectable bonding on the right. She could not be happier. And so you can do this for your patient tomorrow. So how do I get started on this, right? Same thing with this case. Patients come in and say, I chipped this teeth on the upper right. Can you fix it? No, how about ideal design you and let you see what possible and completed it without, and especially this patient request, I don't want any of my tooth structure removed. Wow, how do you do that with porcelain? So if you have more tool and more material in your hand, you can provide patients a lot more treatment options and be profitable. Same case like this. I don't want ortho. He came from UK. And I remember when I finished his case, he FaceTime with his family. And you know, a lot of this picture is unedited. The patient had the same shirt on before the procedure compared to the after procedure. That's how real we want it. We don't want the patient to come back with makeup. This is how big the smile contributes to their face, their confidence, and the happiness. And I not only a certified DSD clinic, DSD master, I'm also a biological and holistic and wellness dentist. And I really like to be called a wellness dentist because nobody wants to have a beautiful smile, but unhealthy teeth. No one wants healthy teeth and ugly smile. So the wellness dentistry bring both of that together, the function, the aesthetic, and the longevity. So what I'm going to do is I'm going to go ahead and go over a DSD case with you guys. And we're going to start with patient intro, photo protocol, and we're going to go in details of starting to finish the case. And this case, completely, you can do it in your practice tomorrow. So Lizzie is 45 years old, female patient from London. She referred from an orthodontist because she just had her braces debond, like she's just had the braces off, and she's not happy. The gap is too big between two front teeth, 8 and 9, and she does not like the existing shape of her teeth. Here's is the DSD protocol. There's 5 photos. The first photo is smiling with teeth apart. The second photo is when patients say Emma. Same 2 picture, but on the profile setting. And then the 12 o'clock picture when patient look up so you can see the lip line. A video when patient talking, and an STL file. That's all you need to start your digital smile design record case. So meet our patient, Lizzie. She's really don't like to smile big because she doesn't like how she look, even the braces was done. And this is her with the 12 o'clock pictures. And this is her closing up so you can see she never complained about gummy smile. She all complained about, I don't like my teeth. Patients may say, I don't like my smile, and you have no clue what that means until you show them what's possible, and then they will tell you, yeah, that's exactly what I want. So with Lizzie, this is her STL file. You can see that the ortho was done, but because of her proportion, the gap is still there, and there's no way they can close it, not compromise the occlusion. So we're going to get all the 5 pictures from Lizzie, the STL file, the video, and all right, so count 1, 2, and we go into the design. So this is something that digital smile design working with, and I want to show you how detailed it is for them to come up with the design. So this is the sequence. Number 1, we always want a midline on with the face, and that basically called digital face bow. Midline is not on, nothing else works. People will recognize when the midline is off right away. It's either crooked or it's off to the side. Second, the smile curve. You want to make sure the teeth is on that curve. And then the next one is interdental proportion, right? Then central proportion, then gingival curve, papilla curve, the 12 o'clock, and then the occlusal arch. So all of these are coming to the design. And the good news is you don't have to do this. DSD will do that for you, but you have to know what those lines are and then do quality check on it. So when they go into Lizzie face, this is called a 2D design. Then they draw it on the face. This is the digital face bow. And you can see that divide the sequence, divide that space. And so you can have a very natural looking, including gum and teeth proportion. Then now the 3D design go in. You can see that it met all that curve, and that's superimposed in her photos. The 12 o'clock to make sure that her teeth are not sticking out or not too much lingual. Make sure that she have lip support. So that 3D design. Then you look at the occlusal. This one critical because I can see where the white colors, I know that where the restoration gonna end. Doesn't matter you're doing injectable or you're doing porcelain, you know where your margin is gonna be on those anterior teeth. On the posterior teeth, you can see that there's full coverage there. Now, these are ideal smile design. Patient still the final person saying, I accept this many teeth, I want to do all of them, or I don't want anything. So Your job is just design the ideal, present to the patient, and let the patient choose. I really love the model on the lower right. That basically a super transparent superimposed on the existing teeth and the design over it. So you can see how much lengthen you have, what teeth need the work, and then from there you can come up with your treatment plan. So treatment plan here is really facial driven. However, it's also very easy for you to see what needs to be done, any adjustment, any gum lift, all of that information. So the picture on the left, the model on the left is an ideal pre-treatment. And then the image on the right is the ideal post-treatment. So you can see that there's gum lift done. There's a little bit of reductions on facial of 9. But overall, she's going to look amazing. Because how do I know that? I'm going to try the design on. I'm not just looking at the screen. I'm actually going to try the design on Lindsay. And in order to try the design on, DSD would give you an STL called Motivational 3D Design, which means you don't have to touch the teeth. You just put this design over the existing teeth. Then patient can have the experience to test out. We call it test drive your smile. And that way they can see how they look before they commit it to the treatment. And you also get the confidence because what they see is exactly what they're getting. A lot of time we send cases to the lab and the provisional look beautiful and you expect the final look the same and it's not. How disappointing is that? Because patient would be asking the question, why I like my provisional better and in the final, the shape doesn't look like that. Well, that never happened with DSD. So I can show you the STL model, the original, the 2D design, the 3D design, and then also the printing. We're actually making the silicone key to transfer the motivational mock-up into the patient mouth. And you can see that we're actually trimming it to get some key channel so the excess material flowing out. And when you take it out, you don't have any excess on the patient gum. So look at again for the wax up quality control. You can see that her, existing, then her 2D design before treatment and then after treatment. And I show her the mock-up or the test drive. We bring Lizzie in and we take picture before we put the test drive on, and we take picture with the design on. And she could not stop smiling. She doesn't see anything about her gum. She see that it's symmetrical on both sides. She's super happy and she just want to start. So not only that, we take some beautiful headshot, and this is strictly motivational mock-up. It's not her final picture. It just is showing her, Lizzie, if you are doing what we designed, this is what you're going to look like. And Lizzie actually asked for this picture and she's want to keep it and she's want to start. So a few more of the motivational picture, and we send patient in such a nice presentations and email and congratulate them. So they're really looking forward to get this. And the question always like, when can I start? And we want to close up also so she can see. So in this case, you can see that the symmetrical, bringing that gum, bringing that gap, bringing everything together. And here's the interesting question from Lizzie. She said, I really love the design, Dr. Katie, it is beautiful, but I don't want to do all the teeth. Can I do just 6 in the front? And so you're going to pause and say, okay, all right, let me look at that. So you can go back to the DSD and say, patient accepts 6 front teeth. Let me take a look to see how it look in the patient mouth. In the end, this is the patient decision. It's their body, their choice. So you really want to give them opportunity to test drive what they want. And if it's work, go for it, right? So in Lizzie's case, she's loved the design. She want to start, but she doesn't want to do any premolars or molars in the back. Okay. So we really have a lot of options here because patient doesn't have to do a full mouth. If she's 1 to 6 front teeth, we're going to try to achieve that without compromise the occlusion and the function. So for LESI treatment plan, we go ahead with teeth whitening because if we're doing 6 front teeth, the premolar is going to show, it's going to have the colors in there that not matching with our composite. We also know she needs gingivoplasty, or we call gum lift. Patient have no clue what gingivoplasty is, so we always call gum lift for patient. And of course, direct composite bonding with our injectable technique. We always present to the patient a second option. And what I'm trying to tell everyone is you want to tell patient that once you have the digital smile design, you have the blueprint for your house. Are you building your house with brick or with marble or any material you want? The shape and the contour of the teeth should be the same. So the same thing here, you can do it with glass, which is ceramic veneer, or you can do with composite, and it should turn out to be the same. And definitely there's a difference in maintenance and longevity, and patient always get all of that information ahead of time. So first step for LESI whitening, and there's only 2 whitening options in my office. We say that it go big or go home. You can either do the core whitening or you can go take home whitening. So if you want to do it yourself, we just gonna give you the opalescent gold from Ultradent. That's what we use. You can use Polar White. You can use any take home whitening that you prefer. And so for LESI, especially she's doing 6 front teeth and keep the rest a natural color, we prescribe her. I use the word prescribe because it is prescription strength. We use Core Max, and that's our go-to system in our office, in-office whitening. And so this is her result after finishing the protocol of Core Max, and now she at 1M1. So she's cannot be like, even at this stage, Lizzie was super happy. Lizzie was like, I'm excited. I can see the changes already. And this is an amazing slide from the digital smile design presentation that you provided when you designed the case with DSD. Is the measurement for your gum lift. So you can see that Lizzie needs about 3 teeth. Each tooth have exact measurements of it. You can also print this guy out and use it when you doing the gum lift or the gingivoplasty. Or even there's a lot of functional crown lengthening, you can do that too. Or you can send that to your periodontist and they would be so happy to know the guy where the gingival margins of the restoration is supposed to be. So we love this because we can see how much we need to add. We can see where the gum is supposed to be. You can do this in your office if you are confident with perio restorative interface. So my favorite slide is this one in the presentation of DSD. Then we did it with laser. So you can see that we level 8 and 9. We go back to this. So we know that 11 have a tiny bit 0.71 millimeter. And we'll do that too. We also make sure that she doesn't have any puffy gum, interpapilla gum that kind of grow in and interfere with the injection. And then the model is directly printed from the STL file provided by DSD. And it's time to make your matrix. So in order for making the matrix, we are having the pressure pot. Then I test out so many different clear PVS to make the matrix, and the winner is Exoclear. Exoclear is super clear, super stable, and very easy to work with. And so don't waste your time. I already do the testing for you. Exoclear is the way to go. And we always have Exoclear in our office because that's what we use to make the matrix. And it's super easy. We actually delegate it to our system and they make it for us every time we do the cases in the office. If you don't know how to make it, you can send it to the lab and they can help you with that. So interesting about this case, because it's digital smart design, we want to work smarter and not harder. So what we do is we having two model, and we request this from DSD called DSD Direct. They would make one model is every other tooth, and one model would be all the design. So you're going to use the alternative model first, then you're going to inject the second round with the full models. And I'm going to walk you through step by step on this. I know it's maybe sound confusing a little bit, but just hang tight. So in order for you to using, you have to make the matrix face model. So you can see I make matrix for the alternate model and then the full model. Then we go into the mouth. So here you go. This is the alternate model, which means I'm going to cover the teeth that I'm not injecting. And you can see that we're injecting every other teeth. In this case, we're injecting number 7, number 9, and number 11. So those 3 first. And now that because of the other teeth are exactly the same, the matrix are super stable. So we don't have to worry about it moving or it, dislodging. Then that's what it looked like when we're done with 7, 9, and 11. And you can tell that the color matching from the composite are really close. And this is without any polishings or any enhancings or glazing or anything like that. Then we isolate the other one with Teflon tape again, do the etching, and voila, we're done with the 6 in the front. Would I want to enhance the result of this case by doing more? Absolutely. However, remember the patient, the one that in charge of their final treatment plan. The best treatment plan for them is the one that fit into their life right now, because they always can come back and say, yeah, you're right. I want to do the other 4 teeth, right? Or 6 teeth. So this is her right after. You can see that the gum with the laser is still there. And she's loved every angle of it. And this is her before and after. I want to show that one again on the side. And this is a same day picture. She literally just got out of the chair and we take the pictures. Okay. She's a very good model. And there we go. So in this slide, I want to show you, yeah, she's a really good model. In this slide, I want to show you how we, from design, initial to the 3D planning, to the motivational, to the final, it's exactly the same. It's just that the final, she go home with it. She can floss in between them. She can show it off, right? So you can see that how accuracy it is. And no matter what material you use, this should be the case. You should be from the planning to the test drive to the final. It should be exactly the same. And of course, I selfie with her and I'm like, oh my God, your teeth are so much brighter and better than my teeth. And I love this slide because a lot of people are asking me, like, if I want to do a case like that, what do I need? So I have it all here for you. My very strong belief in the the business of dentistry is simplify, right? Because you don't want to carry 20 different composite or bond or all these things. So if you look on this slide, you will see that the unperforated tray, you can get that from Cosmodent or eBay or any of dental dealer out there. You can get this. GC Extra Clear, that's number 1 choice. I already try everything. Don't waste your time. Just go for it. Make sure you stock that. And the blade to trim, and then nano varnish is the secret ingredient here. We call it secret sauce. So nano varnish is the very last step after we're polishing and we put them on. So if you don't have it, buy a bottle. You will thank me later. We use Super Snap or any of the, I would say the disc. I like extra fine. And if you don't have, I would say the electric hand pieces, then you will realize that I need the electric handpiece. So these polishing step requires such a slow speed, sometimes 4,000, 7,000. And if you don't have the electric handpiece, it's really hard to be accurate according to the manufacturer instruction. And next to that, you see the injectable composite. So that's my go-to colors for patients that do whitening is the BW. That's my favorite color, actually. It's not only having the hint of enamel, it's also have the dentin. So it's really do a nice job blocking colors, but also make it look natural and shine. Then, of course, the soft contact. You need to have contact that's flossable. And that's the key thing here. None of them are glued together unless you're doing a bridge, right? And we're going to show a bridge case in just a little bit. Then I like the polishings point right there. And the go-to is the Diacom feather for composite from Brasseler. So I keep my system very simple. If you're asking me, are you polishing your class 2 composite like that? Yes, I do. You want to keep it simple so your stocking and your supply is simple, your assistant not confused. And even for the burr, we only have 2 burr really to trim cases like this, is the ET9 carbide and then the DET9 fine diamond for the margin. And we want alcohol. Why? Not for us to disinfecting, but it's also spraying on the extra clear matrix to get it even clearer. So when you inject, you can see better. Then it doesn't have to be deoxy ultra dense. It can be any, I would say, oxygen inhibitor layer that you put on. And very interesting that the more deox or the more oxygen layer inhibitor you put on, the better the color of the composite going to be. Do it and then tell me if that's correct, because I have cases to show you that before the oxygen inhibit layer, the composite is more yellow tint. And then after you do about a couple time of the oxygen inhibit layer, it's get lighter and the color more stable. And of course, patients love it. You cannot do it without Teflon tape. It's $1 each. So get it from Amazon, get it from your Home Depot, it doesn't matter. But keep in mind the white one is the one that thin. The yellow is too thick for the technique. And of course, Shopee is just to marking on the matrix, the Q-tip to clean inside the matrix. And voila, that's all you need to do the case. So if you want this slide, just let us know and then I will share that with you. And this is her. This is, I bring her back about a month later. And I just want to see how does it look? The post-op, the occlusion, and she's super happy. Till this day, she still said that this is the best decision ever. And we did not grind any tooth structure down. So underneath the injectable composite is all her enamel, her precious enamel that none of us will be able to grow back if we remove them. And so later on, I did her son case, her daughter case. So once you gain the patient trust and when they understand that you're very different, you offer options that preserving their teeth, because these patients are still young. They would definitely talk about you. She's referred her friends. She's really a big advocate for our practice. And this is another case that patient got done with Invisalign. And of course, her teeth used to be crooked and now straightening out. It was like one long, one short. And it drives her crazy. So she's one to do very minimal invasive or even non-invasive, but a more attractive smile. And so we don't have to ideal design everyone. In this case, if you're looking at the before and after picture, we're literally doing 3 teeth on top and then 1 tooth on the bottom. That's it. That's all we do to get her smile in balance and she's in love with it. So you don't have to do the whole mouth. With the injectable technique, once you got the digital wax up or the design down, you can just go inject the composite on it. This case, patients finish Invisalign, pack lateral. When you see pack lateral, you see them everywhere. Everywhere in your practice have pack lateral cases. Not only in teenagers, but a lot of adults have them. And the funny thing is, before ortho or even after ortho is done, a lot of patients don't know what it is that they don't like the smile. They're like, something is missing. So this picture right here actually was on Instagram and bring me so many patients because they're like, my teeth was like this, and I'm in active ortho, and I want someone like you to do it without veneers, without cutting my teeth down or prepping my teeth. So we do 2 units here in this case, number 7 and 10, and the patient's super, super happy. And she actually traveled about 3 hours to our office, and she found us on Instagram on the before and after cases. Same that case down here. The patient said, I know I need ortho, but right now I cannot walk around with chipped 2 front teeth and one long, one short. And we said, no, we can help with that. So again, you think that a lot of, dentists that doing this technique, doing full mouth, which is, we do a lot more, yes. But we're also doing a lot of the small cases. It's give you a lot of satisfactions and super duper easy. So in this case, we do 2 bonding on 24, 25, and 1 bonding on number 8. And at this time, my fee for the 3 unit in my practice is $1,000 each. So I finished the case in 50 minutes, and it's $3,000. So you can be very productive and profitable, and there's nothing on this case except lab fee for wax up for 3 teeth, making the matrix with extra clear, and you're ready to roll. So the more tool you have under your belt, the more you can offer. And if no one else out there can offer what you offer, now you can set the price. Same with Apple computer, same with Tesla, right? There's no competition. There's nothing to compare to. You set your own fee and you set your own price for the treatment. This one down here is a transitional case. So not every case will be permanent case. In fact, the patient here missing 2 canines and don't have money to do implant, but cannot afford just walking around like this. So we want to transitional. We want something that she can, keep the space, maintaining the space and function, and composite, injectable composite is a choice to go. So you can see the functions and where we can use this technique is so diverse. And this case is one of my really favorite case. The patient actually see 2 different dentists, and both of the dentists recommending porcelain veneer. And by the time she in my chair, she said, I'm getting married in 3 weeks. Oh, I don't like cases like that, right? 3 weeks, okay. However, I'm asking her, what is it that you're looking for? She said, I don't want gap in my teeth. I don't want my teeth like worn down, breaking. So we decide that with her budget and with her timing, we're gonna do 4 teeth in the front. That's it. And with 4 teeth in the front, that completely meet her expectation. And she's super happy. She showed me her wedding pictures, and she said her husband said this is the best decision ever because she's always complaining and hate her smile. So you can do that for someone and really change how they look on the most important day of their life by doing the injectable technique composite that you have in your office already. You don't have to wait for the lab to return your porcelain. You don't have to cut the teeth down. In this case, we don't touch her enamel. Again, we don't touch any of the enamel. They have all of that underneath the bonding. This is very interesting case. And in fact, I love this case because the patient is 14 years old. The prosthodontist was the one that referred the patient to me. And basically said that she is not old enough for implants. She's missing congenital missing 7 and 10. The orthodontist don't want to take the braces off because right now the bracket holding 7 and 10 in there to make sure that she's having teeth when she go to school. So it's time for the braces to come off, but I keep waiting to see what is the transitional options here. And so by the time we take the braces off, we can see that her canine, her central, and the spatio-lateral on can benefit from improvement. Now, keep in mind this case, when she see me, the top picture, she was in braces, and we actually scanned her with our digital scanner, taking the 5 pictures, 1 video, and that STL file we scan. We send it to Digital Smile Design. Then they tell us, please tell the orthodontist to move this and do that so the design can work out better. So I actually go back to the orthodontist who ready to take her braces off and said, can you please, this is the design that we come up with that fit her face and her smile. And the orthodontist is so gracefully make the movement that we request. And that way we don't have to prep any teeth while be able to giving her a very beautiful transition smile. And so the bottom picture is that bonding. So it's actually a bridge from 6 to 8, and then from 9 to 11. And patients are super happy with the outcome. The parents are so grateful. And this is something that you see a lot in your practice with teenagers when they're missing teeth and they end up with the Holly with teeth in there or some sort of partial. And it's really a confident killer. If you have to wear a partial and then you're a teenager and you lost it, it's devastated. So if you can give something like this without grinding the teeth down, and is also a guide for the future where she's ready for implant, the prosthodontist can just place it right where 7 and 10 is, and we can restore that. So really a rewarding case for me. And since that case, we've done a lot of these options because we also share that onto social media and people find their way to our office for it. This is the case that people found us on social media. She had that number 9 trauma, had root canals, then root canal fell on her twice, and she ended up had to remove it. And if you're looking at that space between A and 10, number 9 used to have a gap. She used to have a diastema there. And now if you're just working on one tooth, you will have a giant number 9 and everyone gonna see it. So when she come in, she also said, I don't have the money for the implant. I don't wanna wear flipper. Is anything you can do? And I saw you do cases like this. So we agreed that we're gonna just digital design it first. And we aim for not only closing that gap, but make her smile transitional natural. And that's when we are designing just from 7 to 10. So when we design 7 to 10, we can distribute the space evenly. The picture you see here is immediate after. So you definitely, we have picture of her 1 month, 3 months, 6 months, a year follow-up. And she's could not happier. She's actually think that now her smile look better than even before the accident. So you can do this technique, and we having a very detailed instructions on the bridge case like this, what support we use to build a pontic, and how do we inject bridges like that to let it have longevity and functions in place. And a lot of people asking me about pedo case because we have people travel hours to come see us because this is what the kid teeth look like. And of course, when we're seeing this, we don't just jump in and say, yeah, we can do bonding. We actually asking the parents about nutrition, about sleep pattern, about mouth breather or mouth opening when they sleep. A lot of that affecting why this kid have no cavity in the posterior, only in the anterior. So please just don't treat the sign and symptom. please asking questions. And that's why wellness dentistry is so important. We just don't want to have to fix it and then our work break down because they have the same eating, same nutrition, same habit. So in this case, the patient doing a lot before we start restoring the teeth because we really want the result to be long lasting. So you can tell that, D and G is super short. However, on the lingual, thank God, we do have some wall. On the facial of D, we have some wall. And so we definitely have some retention here. And this case right now are going on 2 years, and we have the record of it. And he still have the bonding on. And moms are just amazed at the result because he was told by not one, but 3 pediatric dentists that either porcelain cap or stainless steel cap in the front. And after this case, our practice have a lot of pediatric cases because people talk and people know that this option is available. A little bit about this case is the total time I do for it. So we end up doing 6 front teeth. None of them are bonded. He can floss. We actually prefer a gap in between the teeth. And so that way it can be easy to brush and floss there for a 4-year-old. Patient is 4-year-old when I was seeing him. And so you can tell that the 6 front teeth had some decay. They were trying with silver nitrate, or a lot of us are familiar with SDF. But in this case, the patient was seeing a holistic dentist and will apply silver nitrate. And so the cavity arrested, but the stain is just horrific. And he refused to go to school, not smiling, and mom's really worried about it. So once we be able to help the patient, he super happy. He actually loved coming to our office because he know that we the one that helping him with have that smile back. And so we do have detailed instructions on this case also, and we hope to share with you on a different occasion. But here you can see 2 years in, and he still have all the bonding from the injectable composite. This case actually was done last week in my practice, and this is my lead assistant. She's really don't like. I honestly think that after ortho, she does have a lot of collapsing or loss of the vertical, and her 4 and 5s are implant and is really don't have enough room to restore and get it in functions. Same thing with her 12, 13, and 14s, that crown that need to be redone. I don't want to do those crown in the same exact vertical that she have, which is she lost a lot of tooth structure. I want to build that up. And so we start with the deprogramming, then send the record, 5 pictures, 1 video, then STL file to DSD. And we ask DSD to help us design. So I'll show you a little bit of the case here. So this is her before and after. But if you look, we are testing out the color first because she have quite a bit of lengthening that we do. You may not see it in this picture, but I'll show you in the next one. So first of all, we want to check if we have to do any beveling or prepping. We prefer none, right? Because we want to make sure we can preserve her beautiful enamel underneath. And so I'm using the exact DSD workflow that I show you in the other case, every other teeth. That's what we do. We inject every other teeth in there. And you can tell we lengthen a good 1.5 on the incisal, give her the canine guidance again, give her some room for her crown implant so we can really build her bite and not give her the same exact vertical with all that new restoration that she's going to get. And this is the before and after. By the way, you can see it the same day. She's having her scrub on, her hair is the same. There's no makeup except lip balm to make sure that, she doesn't have crack and chapped lips after the work. It took me 2 hours for 10 teeth on the top. And everyone thinks she had plastic surgery. It's just the teeth. Open vertical on the teeth is a facelift. A lot of people in Hollywood calling that, right? This is a dental facelift. So her face look a little slimmer. She's happy that she's showing more teeth. You can see that the teeth having, shape of a natural teeth. And she's been showing to all my patients. She's like, I got my teeth done. So if you can helping your team member, it's very rewarding. And they talk nonstop about their treatment and how excited they are. And people can see the difference in her face. So I'm really happy for Blanca. And I hope you see her in person and can see how happy she is with the result. And I tell her, put your hair down. I know you have scrub on, but let's take some picture. And she's looking really good. We have a photo studio. But yes, I'm really happy with her outcome. And 2 hours for 10 teeth. I mean, can you do that with your hand-free composite? Or even with the injectable, but without the technique of DSD, it's going to be very hard to finish that in 2 hours. And so I really appreciate everyone for your attentions. This is my email. I'm going to put that back on again. And please reach out. Also connect on Facebook and Instagram at Dr. Katie Toe. And I'm ready for some Q&A. I'm going to go ahead and look. The first questions we have is what composite use? So I'm a big fan because I'm doing so many cases. I'm keeping my system very simple. I have composite in all of these cases that you see, they are GC injectable composite BW. And some of the earlier case back in 2017, I was using GC universal flow BW. Perfect. So the next questions is how did you accomplish the gingivoplastia number A with Lizzie during the test drive? So on the test drive model, they already have the link of the teeth on the gum. So really patient will see that look like they have the gingivoplasty done, but it is just the teeth sitting on top of the gum. So they can see that when it's done, that's how they look. Okay. Cost. I know a lot of us are very savvy business dentists. Of course, we're running business here. How much is the case? So right now for us, we are doing a $1,500 per tooth. So if the patient doing 6 teeth, you do the math, it's $9,000. And on top of it, we have by equilibrating, we have appliance to protect them, and we give every case 5 years warranty, no question asked. So we've been raising the fees in 2021. It used to be $1,000 a unit, now $1,500 a unit. Okay. Last question here, how do we get started with DSD? Yeah, so if you go to digitalsmiledesign.com, you can sign up for residency classes. And when you finish the residency one, you can have opportunity to join and send your case into DSD and get the process going. The next questions is photography setup. Yes. So for the photography setup, depends on your space in your practice. You can have softbox and the DSLR, and especially the lens that you see is 100, the macro lens 100 millimeter. So those are enough for you to have the picture that you see in the presentation. However, my in-operatory setup is a very simple round box ring light and my camera with that 100 millimeter. So I can get a consistency lighting, because when you do the case, you cannot just drag patients to the studio or get them up. You have to be able to still have a very efficient workflow, because in the end, I'm a full-time clinician in my practice. So I want to make sure not every case had to be dragging out as a lecture case. I have to make sure it's flowing. And just like I said, right now, my 10 unit case are 2 hours. So if I'm going to take a picture of every step of the edge, of the bond, of the injectable, then it's definitely going to take a lot longer than that. And patients can be, uncomfortable. So you had to have the setup to be so simple and so efficient that just grab the camera and you're ready to go. How do I make the holes for the composite tip in the matrix? Yes. So on the matrix, once you put in the pressure pot and you put it on the model, when you take it out, you just use the Sharpie to mark the incisal edge of the each tooth that you're going to inject, and you're going to just get 330, the carbide burr 330, and go straight through that and make the hole through the tooth. So the good thing about the injectable composite from GC, the tip is a metal tip. So you just insert that metal tip into that hole that you created with 330 to make sure you have a really snug seal. And so when you inject, all the air bubble, everything that you think would happen in flowable composite or injectable composite won't happen to your restoration. I got these questions a lot. How strong is it? As flowable is not as strong as packable or porcelain. Well, 20 years ago, we know flowable was flowable. These days, flowables are a different game. You can use it for a lot of class 1, 2, 3, 4. And especially with the injectable technique, you get really solid coverage. And the important thing is, doesn't matter is a natural tooth, is a porcelain restorations, or is a composite, occlusion is the key. So every single case you see here, except the pedo case, we use T-scan to calibrate and equilibrate the bite. And we can see on the computer the forces on each tooth, the time, the disclusion time, the time of when it hitting, and we're really intentional about that. That's the reason why things last longer, not because it was just macro occlusion, it's also micro occlusion, and we're using T-scan for that. So you can probably do it with, blue, green, red paper, but I want to be efficient, and also I want patients to know that this is why they're paying for what they pay, because we use technology, the digital smart design, the T-scan, and so their restoration lasts longer. And if they last longer, I don't have to do repair because my warranty is 5 years. And just like anything that you buy, say, for example, car, you have 50,000 mile, 4 years warranty. And when something happened, the consumer expect to pay for it. We're very clear about that also. It doesn't mean that everyone after 5 years will have to pay for new bonding. Our warranty policies are very strong. It creates confidence in the buyer or the patient. So I can tell you that the better your occlusion on anything, single crown, composite, or full mouth composite, as long as your occlusions are good, you're in good shape. Because look at people, natural teeth. They're grind out what God gave them. And so what you give them, no matter porcelain or composite, if you don't dial the occlusion in, you're going to end up with the same disaster faster. So I tell patients 5 years. However, patients at this point have it longer than 5 years, and they're super happy about it. And in our policy of warranty, we want to make sure at least they come. A lot of patients are travel to us, or they have their own dentist, and the dentists don't offer this service, so they come to us. But our policy is they have to come to us once a year for polishing and for checkup, so we can maintain the warranty, knowing that they take care of it. Because yes, most of people say, I spend this much money, take care of it, but we don't want them to tell us that they take care of it and they don't. So we have a very clear policy on that, and patients actually love coming to us for getting their polishing, their cleaning, because we're not using Prophy cup on these or Prophy paste on these. We do a technology called guided biofilm therapy. It's a unit that just air and 14 micron aluminum oxide. I mean, basically the very fine air abrasion to get the stain off between the teeth, and then polishings and glazing for them. So that's a service we provide. And then they actually paying for that. So our hygiene is the one that take care of all that maintenance for the patient. The oxygen inhibitor layers are just a liquid gel. It's like glycerin, so you rinse it off before you polish. That's that. The question is about oxygen inhibitor layer. And how can we see how the pediatric case? So if you email me at drkatie@katietodds.com, I will send you the link for the pediatric case that we have. I love all the questions. You guys so wonderful. Thank you for paying attention. And please reach out, follow us on DM me on Instagram or message me on Facebook. I would love to connect. It really changing our practice, and people traveling from all over the place. We have people from Michigan, California, Florida. And the funny thing is they found us on social media, or their friends and family talk about us. But you never know the potential of a skill like this. People love that they don't. And by the way, majority of the case, patients don't even to be numb for it unless they need gum lift or anything like that. So last question I saw, do you have additional charge for the DSD workup? Or that's included in the fee? No, the DSD workup is $1,500. We used to give them that $1,500 credit toward their treatment, but now we don't, just because we can see the patients benefit from it. Because a lot of cases, before I do the bonding, patient actually end up with orthodontic treatment or with periodontal surgery. So our DSD workup is $1,500, including 2 visits. The first visit is a DSD record, the 5 photos, the 5 photos, 1 video, and the STL file. And the second visit included is that test drive visit. And they also receive their pictures from the visit and the game plan. So they know exactly what needs to be done to get where they are to where they want to be. The pediatric case was not done under general anesthesia. The patient was not even be numb for it. So no, it was done really quickly, and I'm grateful that have a good 4-year-olds in the chair. What is the bleaching called? That's whitening system called KOR, KOR. Yeah, so you can definitely contact them and get that system going in your office. I know you guys still have more questions. Just email me, contact on Facebook or Instagram. I'll be happy to send you more pictures and cases, because I know a lot of people have questions about the bridge. That's a whole different presentation. And then also we have presentations on the pediatric case too. So I would love to share with you on those information. Just reach out. We can send you the link and the information on that. Especially the bridge case. I know it's very interesting, and we do a lot of that in our office these days.